Hi friends, now I am going to start the antihypertensive drugs. Very interesting thing. So let us start. So what is antihypertensive drugs? So antihypertensive drugs are the drugs which decrease the blood pressure. So the antihypertensive drugs are classified in the following groups. Antihypertensive drugs. So first classification, number 1, that is called diuretics. Diuretics. They are again classified into different groups. That is thiazide diuretics. Next, loop diuretics, potassium sparing diuretics. Next, go for sympathomimetics. They are again classified in the following groups. Number 1, centrally acting sympathomimetics. Next, adrenergic neuron blocking agent. Next, ganglionic blocking agent. Next, non-epinephrine reuptake inhibitors. Next, adrenoreceptor blockers. Here they are alpha blockers, beta blockers, and combined alpha and beta blockers. Next, vasodilators. They are again classified in the following groups. Arterial vasodilators, venous vasodilator. Next, indirect vasodilators. So let us start. So the antihypertensive drugs are classified in the following groups. First one, we are diuretics. What do you mean by diuretics? Diuretics are the drugs which increase the urine outflow. The diuretics are very important drugs which are used to treat the hypertension. So what are the diuretics used in the case of hypertension? First one is called thiazide diuretics. Thiazide and related diuretics. So what are the thiazide diuretics used here? Example, chlorothiazide, hydrochlorothiazide and indapamide we can use in the treatment of hypertension. Then loop diuretics. What does it mean, loop diuretics? Loop diuretics are the drugs which are inhibiting the absorption of the sodium and water from the loop of Henle are known as loop diuretics. Example, furosemide, bumetanide. Next, go for the potassium sparing diuretics. What does it mean? Potassium sparing diuretics means the drugs or the diuretics which inhibit the excretion of the potassium ion in the urine are designated as potassium sparing diuretics. Example, potassium sparing diuretics, that is called triamterene, amiloride. These are the example for the potassium sparing diuretics. Then go for the sympathomimetics. What do you mean by sympathomimetics? The drugs which are acting on the adrenergic receptors are known as sympathomimetics or adrenergic drugs. So we can use different types of adrenergic drugs to treat the hypertension. Number 1, centrally acting adrenergic drug. What are the example? Methyl dopa, clonidine, guanifacin, guanavenge. These are the centrally acting adrenergic drugs which are used to treat the hypertension. Next, adrenergic neuron blocking agent. Adrenergic neuron blocking agent. Example: guanethidine, guanethidine and gonadrel, and bethanidine. These are the three drugs used to block the adrenergic neuron blocking agent, adrenergic neuron, by which they can decrease the blood pressure. Next, for the ganglionic blocking agent. Example, only one here. Only one ganglionic blocking are used to treat the hypertension. That is none other than trimethophan. Then go for the norepinephrine reuptake inhibitors. So what is the function of the norepinephrine or noradrenaline? Because they are the catecholamines. They cause the vasoconstriction to increase the BP. So if the norepinephrine is inhibited in the nerve endings, adrenergic nerve endings, there is no action. So what is the example? Reserpine. It is an immediate reserpine. It is an benzopyrrole alkaloids. Obtained from the Rauwolfia serpentina. So reserpine is an norepinephrine reuptake inhibitors, act as an antihypertensive drug. Next, over the adrenoreceptor blockers. We know what are the adrenergic receptors: alpha, beta. Then alpha 1, alpha 2. Here, what are the drug using? We are using the alpha adrenoreceptor antagonist. Example: prazosin, terazosin, induramine. These are the alpha adrenoreceptor blocker used to treat the hypertension. Next, go for the beta blockers. There are several beta blockers: propranolol, atenolol, acetobutolol, timolol, pindolol. These are the example for the beta adrenoreceptor blocker. Then go for the combined alpha and beta adrenoreceptor blockers. Example: lavitolol. It can inhibit the both alpha and beta adrenoreceptors. Then let us start vasodilators. These important drugs. What is vasodilators? They are the drugs which dilate the vascular smooth muscles, are designated as vascular or vasodilators. They are classified into following groups: arterial vasodilators, venous vasodilators, and indirect vasodilators. Now, what is the example of the arterial vasodilators? Example: hydralazine. Hydralazine is a major arterial vasodilator. Then diazoxide, hydralazine diazoxide is an arterial vasodilator. Then go for the venous vasodilators. Only one. The example is sodium nitroprusside. But sodium nitroprusside are limited use because it has the side effect. So clinically, sodium nitroprusside cannot be used to treat the hypertension due to its adverse effect. Next, go for the indirect vasodilator. They are very important antihypertensive drugs. Indirect vasodilator, they are again classified into the following groups. One is called calcium channel blocker. Second one is called ACE inhibitors. Third one is called angiotensin 2 receptor antagonist. Now, calcium channel blockers again classified into the three groups. How many? There are different types of calcium channel present in the cell membrane. What are they? They are the L type, P type, T type. L type means long acting, T type means transient, N type means neuronal. So all the organic calcium channel blockers are acting through the L type calcium channel. So the calcium channels are again classified into three groups. First group called phenyl alkyl amine derivatives. Example: verapamil, galopamil, tiapamil. These are three major phenyl alkyl amine derivatives of the calcium channel blockers. Second group, benzothiazepine derivatives. Only one example, that is known as diltiazem. Next, third one is called 1,4-dihydropyridine derivatives. Example: nifedipine, philodipine, nizaldipine, nicardipine. These are the example for the 1,4-dihydropyridine derivatives. These are the three groups of the calcium channel blocker used to treat the hypertension. Next, go for ACE inhibitors. means angiotensin converting enzyme. Example, captopril, enalapril, lisinopril, perindopril, ramipril. These are the example for SE inhibitors. Nowadays, very common drugs used to treat the hypertension, that is called captopril. It is a pro drug. Nowadays, every time the hypertensive patient it is using. Next, angiotensin 2 receptor antagonist, last one, that is known as losartan. Losartan. So these are the brief classification of the antihypertensive drugs which are generally used to treat that one. So here the SE inhibitors are most common drugs which inhibit the conversion of the angiotensin 1 to angiotensin 2. So if angiotensin 2 is not formed, there is no other physiological effect. There is no vasoconstriction, there is no release of the aldosterone. So these are the major classification. Thank you guys, and I am requesting the viewers and audience, if you have any doubt, please comment me. As per possible, I will give the answer. And if you like and subscribe my channel, thank you all of you.